time, but thank you for coming. I'll share the screen and then we can see what's on the agenda. I know the first item on agenda is from Jay. So Jay, I just put a general update on there.
Because we're a public meeting now, we have to go through the whole rigmarole.
Oh, yes, of course. Sorry. I'll open the agenda and read it. Thanks for the reminder, Tegan. I always forget that. Can everyone see my screen?
Yes.
So I know I have to read the whole thing, right? Public comments.
No, I just think the public forum portion.
Okay. So those interested are invited to address the Hope Suicide Prevention Task Force on any subject not on today's agenda, orally via Zoom webinar. Instructions are above in the agenda. Speakers may provide their name and city of residence for the record, and comments may be limited to 3 minutes or less at the discretion of the meeting coordinator. As an item not listed on the agenda, no response is required from the city staff or the Hope Suicide Task Force, and no action can be taken. So we can start a meeting now. And the first item.
We have somebody in the attendees, but I don't see any hands up, so.
Okay. No hands up? Okay. No, I don't see either. So Jay, do you want to give your update?
Sure. Hi, everyone. So a few updates from our end. We have first item is that we do have our suicide prevention conference, which I sent out the flyer after last meeting, and I can share out again as folks request or need. So our conference is 2 weeks, so I should say 2 days on separate weeks. It's going to be May 3rd and May 10th, and that's going to be from 9:30 to 1 both days. We split it up that way we could kind of capture more of an audience who might not be able to just do one full day. So we're excited about that, and registration is going to be open for that all the way up until the day before, whichever you select. So if you would like to attend May 3rd's conference day, then you have all the way up till the 2nd, and if you choose the 10th, you have all the way up until the 9th. So that's our first item. The second item is that we did have our most recent campaign wrap up. So we are expecting a report on sort of how things went and how well we reached our audience. A preliminary report coming in mid-April. So next meeting, I should have something maybe a little more concrete to provide you all in terms of results and how well we did with that campaign. And for the upcoming fiscal year, we are looking firmly at doing either gun safety or maybe a little bit more expansive of a means restriction as a whole meeting. But we're not really sure on that just yet. We're still looking at some data. The next item is we have from Jasmine. And Jasmine, I know that John Macon, she's been working with you on sort of trying to get some licenses for the LivingWorks START training. So she said that that's coming along really well. I just talked to her today about it. She said that they're in the process of setting things up with the lead, and they just sort of need to get some other things settled out. And then that's pretty much it. So John, I don't know if you have more. You can follow up on me or follow up after this update if you have any further information. But that's what Jasmine shared with me. So that's, I think, exciting for you all because the LivingWorks START license access would be great. The next thing is that Evelyn wanted us to promote the Chinese Health Initiative, CHI, is having an online workshop on April 28th, and it's called Bridging the Generational Gap. It's going to be with Dr. Wei-Chen Li. And that's going to be a online workshop that's just about how the generational gap is impacting relationship between parents and children specifically, and then how we can connect and maintain our boundaries and relationships, particularly when we're working with teens and young adults' experiences and the challenges that they face. So I can share a flyer after the meeting as well on that. So I think those are our primary updates.
Thank you, Jay. Yeah, if you can share the flyer. I attended the county presentation last week, the town hall for the parents.
Mm-hmm.
Yeah, it was a good one.
Great.
Any questions for Jay, or if you're done, then I can move on to the second item. Done?
Yep.
My item on the agenda is really short. So we have an upcoming town hall. We decided, like in the last meeting, I did make an announcement that we would be doing only one town hall per month. So we have another one coming up, which is to support our teams, and it will be on April 21st at 5:30 p.m. And I know Lisa is going to be doing that, and she just announced. I don't think everybody was here that she's moving on to another job. So this will be her last town hall for us. Thank you, Lisa, for contributing so much to mental health support in Milpitas. And
Thank you. It's been so much fun to support the town halls and just the Hope Task Force. It's just come a long ways from when I first started. And Cheryl, who hopped on, is going to be the new Cassie representative, and she's going to do fantastic too.
yeah. Thank you. And I know we did the last one in Spanish, which was well received. And I did hear back from the parents. They loved it. So thank you. And I hope we can offer in other languages too. And I know we'll continue the discussion with Cheryl in the coming months. So I know we have a full discussion today, and I'll hand it over to Tegan, and I'll just share the screen. So Tegan, do you want to start off the discussion?
Sure, I would love to. It's that time of year where we need to think about what we'd like to do in the next fiscal year. And I just wanted to quickly review what we decided last summer and worked on this year. We put together 3 work groups. The diversity work group, and their charge was adding representatives from groups that were not previously part of HOPE. So we've added representatives from the seniors community, veterans, and youth. We are still looking for somebody from the LGBTQ community and the cultural diversity communities. We also had a postvention work group, and that group, as you've heard recently, we drafted the condolence letter. We created a survivor resource guide, which is ready to go to print after this meeting. And oh, Chari's going to show it to you if you haven't already seen it. So this is, it folds down to a pocket size, and our police officers will carry this with them. So that if they go on a call where there's been a suicide or an attempt, they'll have these handy. They'll be able to give these to families and provide a little bit of resource as they're leaving. I know they also provide it in person. Our third work group was the youth work group. I didn't know what they wanted to highlight, so maybe John would like to hop in real quick and just highlight what they've accomplished over the year.
Yeah, I think well, I think more is going to be in the forthcoming year, but we got our group together and really talked about as far as priorities, and kind of a complement to the town halls we've offered previously, but having six of those type events, workshops. I think Dawn called them huddles, but
okay.
With different themes, but really trying to connect with youth. And we're going to offer that bi-monthly. So our goal is to offer six of those over the next 12 months. And then just getting information out there. We talked about putting together a monthly newsletter that would not only have similar to what you just showed, Tegan, as far as those different resources, but different tips and tricks on certain topics and upcoming events and whatnot. And then as Jay refers with Jasmine Lopez, working with the Works. Yeah, working with Living Works and Jasmine with the county to offer more trainings. So really training and resources focused for the next year.
Okay, good. And then town halls wasn't really a work group, that was more staff driven, but that came up at the request of council. And I think Charu's done an excellent job getting our town halls together throughout the year and been able to provide different targeted audiences with information on mental health resources. And as she mentioned, we will continue that from a staff angle. But moving on to looking ahead to next year, it's time for us to decide if we want to work on some new things and add new work groups, replace any of the work groups. I think postvention is done with its initial things that it wanted to do. But we have lots of ideas that have come up over the course of our meeting together. Some during this year, some from previous years. We've talked about different target groups, veterans, seniors, and as a reminder, we did get some funding that could be applied to seniors through a bequest that we received. We've talked about transitional age youth. That was something that county had on their plans last summer, and we had sort of identified some of the things that they mentioned that we felt like the city could work on as well and help. So those are listed in the hollow bullet points. Same thing with youth. That idea came from, those ideas underneath youth came from the county's documents. We have at various times talked about public safety and hosting some sort of a QPR program for our public safety officers and or gathering and sharing resources with police and fire. We've also talked about general efforts, quarterly themes. This was where we were going prior to COVID. We had identified some target audiences and we were planning to do a different theme each quarter with an event and some marketing toward that particular target audience. But obviously COVID changed the way everybody does everything. Gun safety efforts, we had talked about that in the past, and certainly with what's going on right now in the world, that might be an appropriate one for us to consider. We've talked about messaging resources available for HOPE in multiple languages. Obviously continuing the town halls. Charu has recently started exploring social and support groups. We're getting ready to try an LGBTQ+ one and a seniors one this summer. Perhaps after we get those started, we might want to consider some other groups. And I just threw together a little list of with Charu of target audiences that we might want to address. Charu, you want to share a little bit about the positive messaging idea, since that's really one that came from you?
Sure. So I was thinking more like, we, after kickstarting these social support groups, we also do like bite-sized positive messages out to the community. There are two ways of doing this, and this is just, again, a discussion. And if you have any ideas, we would really welcome those. So one was that we collect the phone numbers where people would like to receive a text message once a week. And it can be general, age specific. So one message for the teens once a week, positive, like, maybe did you exercise today? How many steps did you walk? Or did you have enough water? That kind of a thing. And we can, of course, think of many other ideas. And one would be to the seniors or adults. So that was one way of doing this. It would need a little bit of staff time, but it would be a little, more like general reminders, positive reminders to the community going out every week. Or we could also do one on Facebook and Instagram. And that could be like maybe one Tuesday a week and one Thursday a week. We could pick the dates that really, we kind of know that the community will go and check our Facebook and Instagram pages. So it's more like, a lot of companies and nonprofits are doing this now, I think, sending how to support your mental health in COVID, during COVID times, to their employees. So I thought if we could just bring it to the community in general, that would be a good idea. Some of it, of course, came up from the NAMI when they presented at a last HOPE meeting, that they're doing a song, they're stitching it together in a positive message to the teenagers. So this would just be really bite-sized, just one line. And it would go, with help of maybe interns and even some of the staff, we can start sending a little bit of personalized messages, like suppose, hello, Susie, did you, how about this positive reminder today? That kind of an idea. And of course, it would be supported with a support or a social group every month. And we are kickstarting our LGBTQ+ and a seniors group in June and July. We'll see the audience for that. And, in person or maybe Zoom. We'll see how that goes. The idea of those social and support groups are just for the the population to come together, and also we provide a resource during that support group. So it's like 50-50. They get to socialize, but they also get to learn about few resources to support their mental health. That's the whole idea. But we're open to ideas. Of course, this is just a discussion right now.
Charu, I think the mental health check-in was also one that you threw on the list, so maybe you could cover that one.
So that was another thing, and that again, maybe a 15-minute check-in every month. So we provide a Zoom link to our community and they can check in. For this mental health check-in, I was hoping to draw in some of the mental health providers from the community. Like at least we have one clinician or somebody to support the mental health need. It's not going to be clinical work, but it's just going to be like, we are just coming together to support each other. But we do have a professional who can talk to us about self-care or just how to support our mental health needs in these challenging times. And it would be just very quick, maybe second Saturday of the month, maybe fourth Saturday of the month. A weekend or a weeknight where more people have the opportunity to just check in and see how their week is going or their month is going.
The last two items on the list, the testimonials, we sort of stole that from Gilroy, and I wish I'd made more notes in here because now I'm forgetting the organization. But they do have an event where they invite people who have had struggles with mental health or addiction or something like that to share how they recovered, how they are taking good care of themselves now, that kind of thing. And it seems to be popular in their community. It's just a one time a year event that they bring people together for, but it's, I understand, very inspirational. Then the last one, tabling, of course, when we can all get together in person again. That was something that we had talked about eons ago. We even made ourselves a nice tablecloth with our logo on it, and then we never used it because of COVID. So with that, I've sort of run down all the things that we've talked about in the past, and I would just like to open the floor to hear what resonates with people, what might connect nicely with what county is doing or other organizations are doing, and just see if we can get some focus for our coming fiscal year. So who has thoughts?
Tegan, this is John.
Mhm.
I just want to reaffirm, I think the tabling will be really successful moving forward. Right before COVID, as you mentioned, we had a few of those, and one of them was actually at Pastor Mize at the Cathedral of Faith event, the conference. And Mary was with us at the time, and she actually did an intervention as a result of having that, having the table with the resources and being present. So I think that's a great way to not only for our branding and letting people know we're out there, but helping in the moment.
Mm-hmm. Mm-hmm.
I love the ideas, and for the veterans, I did get it onto the veterans. I asked for it to be including the Veterans Commission because I also wanted their input.
Mm-hmm.
As far as brochures, I was wondering, is it something that we could come up with specifically for a group, or is it something that we just do for Hope? Or I didn't know how the group, as I'm new to this, I'm just wondering
Mm-hmm.
how the group feels about that. And veterans, you kind of find them all over the place. So trying to figure out how to partner, and that's why the email about partnering with NAMI.
Mm-hmm.
and seeing how we can reach our veterans in Milpitas.
So Liliana, if we put together a work group on something like a veterans work group and they wanted us to create a brochure or something like that, we do have a little bit of money, not a lot, but a little bit to do things like that.
Okay.
And if the group thought that would be a useful goal for next year.
Right. Okay,
it could be certainly added. Mhm.
okay, great. Thank you.
Others, Jay, do you want to weigh in as to any of these things that might hook up nicely with efforts that you guys are
As
getting
well.
ready to work on?
Could you, well, actually, I have the agenda myself.
Yeah, do you want the,
Yeah, I mean,
Agenda.
I'm still just taking a peek at it. So
okay. So today we were mostly going to discuss the ideas moving forward, 21, 22. But I can bring it up if somebody wants to look at it. Right. So here are the work groups.
Vic, you always have lots of ideas too.
That's why I'm trying to wait to hear the people who live in your community bring things up. Look, I think it's a good idea to communicate with people. The comments you made towards the end there. This is going back maybe 15 years now. The University of Washington, with their students, sent out a postcard to all of them at one stage to say, how are you doing with your mental health and so on and so forth. It was, a somewhat generalized thing, and they got great results from that because of the fact, maybe it's like this meeting where people aren't jumping forward with a lot of ideas, but what it did was it gave people an opportunity to express themselves. It was sort of a ticket to get into the play. It said, it's okay, we're here. If you have something you want to talk about dealing with your mental health, that's why we're here. And it didn't work necessarily well with the higher risk students, but it worked well with those in the lower or medium categories, where a number of them, came in and sought some support. So there's some other examples, but there's enough out there, I think, that says that that's a method that provides some benefit. There's some usefulness to doing it. So I frankly, my only other comment would be, I applaud you if you're going to do that. It's like most things, we used to kid about this when I was in office. There's a group of people, I'm sure it's the same in Milpitas, right? I'm probably more than sure. There's a group of people always would address the city council on things. But then there was the public, just everybody else who, because of their work schedule or whatever, were reluctant or reticent to say anything. So any way you give people an opening to do that, what I did when I was the mayor was I created a program, and basically people knew that a couple of Saturdays out of the month in one end of the town in the morning and the other end in the afternoon, they could just come and talk to me. I did it out in the public, I did it in shopping centers, near grocery stores or, near the local coffee shop and whatever. And I developed the form, and I, let people tell me whatever it was that they had concerns about. That, and they were always people, all of them were people who would never come in front of the city council. So when you give people the opportunity to say something, especially if it's something they're holding within themselves, because it's something that's either there's so much stigma around it or they're just not comfortable speaking about it. It's a way to open up the gate and say, come on in. So I think you have a good idea there. And I think you probably should follow up on it. It'll be interesting to see what type of feedback you get. Then I'll probably badger Jay about why we're not doing it on a larger scale. And my only other comment I was going to say is I'm just very happy that about how proactive you are in Milpitas. We work in an area where it's difficult again for people to say things. So
so one, I think the one idea that did strike me that I thought I'm interested in, at least, is just the mental health check-in. That we don't do anything at the county that, at least with our program, that's like that. It sounds very unique, and it sounds like it could be a good idea, and we could incorporate, some county resources, or possibly collaborate on that check-in, have a representative, there as well. Something like that sounds like a good collaborative opportunity. And then also, one thing, you may have mentioned this, and it just, one ear out the other. There's the sharing with, or gathering and sharing resources with the police department and fire. Is that is the aim of that to be sharing the suicide prevention and mental health resources with them, or in work with them, in collaboration with them?
I would like for us to work with them. I know that our police representative isn't on the call today, but is part of this group and anxious to work with us. And really, I think that came up from two angles, both the consideration that our police and fire folks are the ones who are probably most likely in the city to encounter somebody who's having a mental health problem.
Got it.
And so to make those folks as prepared as they can to deal with someone's mental health crisis in a compassionate and thoughtful way, it goes a long way. And then also, as they're our colleagues, we know that they also face a considerable amount of stress in their jobs, and suicide is a problem sometimes among police and fire personnel. So just expressing that to them.
Yeah. So that's I just asked just for some clarification for myself, because I wanted to make sure I didn't miss it, because I know especially right now, partnering with police department and fire can be a really strong show of unity. That we're all, in this together, especially because there's just a lot of, tension. And so with our South County work group, I know that they recently just had Morgan Hill. They've been working really closely with Morgan Hill to the point where Morgan Hill adapted some resources and was even putting it up on their own webpage and everything. So I don't find that, at least in my own experience, I don't know about you all, seeing a police department put up suicide prevention resources and tote a new page, I think is some great progress. And if there were something like that you could model after, that kind of collaboration with Morgan Hill could be really, really helpful, because if you're hearing it and seeing it from police, it means they're taking it seriously. So that's the second thing that stands out to me.
Good.
One of the things you want to maybe do there, Tegan, is the county behavioral health department, of which the suicide prevention is a sub program under it. But the department has a program that's mental health law liaisons. And those three officers now go out and work with the various 15 cities police departments. But if you're going to get into a program there, it might be helpful to talk with them. John Costa would probably be a good person, because he also teaches at West Valley College, so he's got a teaching background. Anyway, it might be good to draw them in and talk with them and see how you can collaborate or do something using their expertise, because it's what they do. And I would reinforce the comment that you made. The thing that a lot of people don't realize is first responders have a very high suicide rate. And so anything we sort of ignore it because of all the other things that are happening, but they're a group that's at risk. I mean, they're in a high stress job, obviously. So that's a good thing to bring up. One of the things we did in Palo Alto is because QPR was the main form of training at the time, we trained our city council members in QPR and the top administrators and some of the people from the police department. we did it in the city council chambers.
Mhm, mhm.
You know, this sort of a symbolic message about, you know, the need to do it and the appropriateness of it.
That would be great when we can get back to our city council chambers. That would be awesome.
Yeah, it's a fun thing to do, and
Mhm.
it creates visibility around the program, the sort of a certain level of camaraderie.
Others on the group, are there things on the list or things that are not on the list that excite you and that you would be anxious to work on in the coming year?
I've got two things. One with the first responders. The Bill Wilson has a system group that already works with the first responders, and I'm wondering if that might be a resource that might be able to help with that.
Okay.
And I can put you in touch with those people if you need that. I would very much like to help with the mental health check-in and the positive messaging when
That's great.
if there's an opportunity. Yeah.
Thanks, Liliana. I think I liked Vic's idea of postcards, and I was thinking take it a step further and put a QR code on it so people can scan and get connected to resources. And maybe that could be, especially our younger generation, we could perhaps, that could lead to the mental health check-in. Like, how are you doing? You know, how's your mental health? Would you like to check in? So I
Mhm.
think me and Tegan have some work to do on that. We can do a discussion and report back next month. John, you had your hand raised.
Yeah, I just wanted to, you have it noted here under general efforts as far as messaging about resources available in multiple languages. I just, looking back on the last year, I think we've made great strides as a group in efforting in that regard. I think the town halls in the different languages and our ability to have a lot more of our resources translated, specifically in this community in Chinese and Vietnamese. So I just think that if that can be a continued commitment to the translation piece of our communication, I think we're just going to reach a larger audience. And possibly, I know Charo, I know you're looking to get a social services intern.
Yes.
Maybe there's opportunities at San Jose State for an intern who could help with kind of a focus on that,
Okay.
on our ability to translate and get our materials out there more broadly.
Okay, that's good. And we can touch base offline on that.
This pocket resource guide is really great. Maybe we could get that into other languages too, since we're
Would be a
talking
good
about,
idea.
yeah.
I think I'm a little bit late to this now on figuring this out, but is someone aware that the federal, on the national level, there's a number now that people can call for suicide prevention, 988? Jay, do you know, have you heard anything about it? I haven't checked it out myself, but I just read it somewhere a few weeks ago.
That the national line is going to be 988.
That they have started, like 911, so people can
Well,
call.
I think Vic might be able to comment on this a little more, but I don't think that it's active yet, unless
It's not active yet. Maybe it's just in discussion then.
Well, no, it's been passed, but it's this is going to sound a little bit jaded, but it's the federal government, so it's going to be very slow moving. So I don't think it's supposed to take effect until I want to say 2022. Vic, does that sound right to you?
That's right.
Oh, really? Okay.
Yeah, it's out there a little ways. The interesting thing is there's a bill in the California legislature right now.
Mhm.
I think it's by an assembly member, so it's it's AB 988, and it's looking at, so it's easy to remember, and it's looking at how to implement and facilitate and have people understand how to use 988.
Mm.
And I'd have to go off screen and look at the exact wording again.
Yeah.
But that's what the idea is behind it.
And that makes me just a small caveat here is that with that being said, I'm a little bit hesitant in my role with our program to publicize it too much, because I don't necessarily want folks trying to dial 988 and then they can't reach something during crisis. So still using that full crisis line in any kind of materials for the time being, I think is the best route, and not really mentioning the 988 because people can get sort of set up.
Yeah, no, that's true. I mean, I just wanted to get your feedback on it because I didn't get the whole news.
Mm-hmm.
That's the problem with just reading the highlights sometimes.
Oh, it's okay. I mean, it sounds a lot like, hey, if something passes, both houses of Congress, that it would sort of go into effect, but it doesn't really work that way in this particular case, very unfortunately for, advocates and mental health professionals. So
what the California legislation does is, one of the aspects of it is to hire a director to oversee communications and things around implementing 988.
Yeah.
Elena, I see you have your hand up.
It's actually Cheryl Deacon. I know I just saw you a couple days ago. I'm not sure if you guys have considered this as a resource for the card or not, or if it's gone to print, but United Way 211 is also a good resource. It's not necessarily specific to maybe all the topics regarding mental health, but in a pinch, they do have the 24-hour phone line, and they can provide resources on that phone in case of an emergency. So just some food for thought on that.
Yeah. We have the 211 on our resource guide.
Okay, my apologies. I didn't see it. Okay, it's a great
That's
resource.
fine. Yeah, the screen is a little, if I make it, bigger, then people
No
can only
worries.
see. Yeah,
I know I'm new to the group, so I'm coming in here in the middle. Sorry about that.
that's
No.
fine.
Others we haven't heard from, do you want to weigh in? Let me ask you, it sounds like the youth work group still has work that they'd like to accomplish. The diversity group probably could keep going, or we could phase that out and put a different work group in to focus on a different area right now, and just know that we're always welcoming more diverse members to this group, but maybe not have a work group devoted to it right now. Postvention, as I said, I think we've probably completed most of our initial goals, the last one being the media training, which Jay and Joy Alexu and maybe Mego, if Jay can't make it, will be doing for us on May 14th, and you guys will all be getting an invitation to that, but that's postvention media training, so we're really excited about that.
yeah, Tegan, I just wanted to get out in front of it. I didn't mention it because I didn't know if it was something you were ready to bring to the group, but yes, we're excited for that as well. We like getting out and being able to do that training. And thank you for asking us, because we have that presentation like always at the ready. So
Good.
We appreciate it. And we think it's a good training. People usually traditionally have liked it.
Mm-hmm.
So there's a lot of information, and Joy is, an expert on this stuff. And it's been amazing for me even to get to train with her. It feels kind of like an honor in a lot of ways. So hopefully I'll be able to make that one. If not, Mego obviously is another expert. So you're in good hands.
Good, good. Do we want to wrap it up for today and think about the things that everybody has contributed so far, and maybe we can focus back on some of these next meeting and figure out if we want to put some new work groups together and who would like to do what?
Before we do that, Lisa has her hand up. Lisa,
Oh, I'm sorry. I'm so sorry, Lisa. Go ahead.
It's okay. My hand got stuck at first and it wouldn't raise, and then, technology. But, I was just thinking maybe not so much related to this, but before we close the meeting, I did want to bring up what's been going on in, the county and even the country right now with Asian American Pacific Islander hate crimes. And I know that's something that's coming up with our clients a lot. And to just put out there, I wasn't sure if the Hope Task Force had talked about that at all or had made any kind of statement of support, or unfortunately I missed the last meeting. So I just wanted to throw that out there, that we are hearing from the young people about that and the families and how that's impacting them.
So the city has made some general statements, but Hope in particular hasn't stepped aside from the city and made its own statement. We could, for sure.
I was just thinking it might be a good time to do some extra outreach towards that community in some way, because things are unfortunately very hard and targeted at them right now.
Great point.
That's great. I know I'm talking to public allies on the site for some kind of a conversation with on this topic with our community. So more to come on that in a few weeks.
So I'd suggest that you talk with the folks at Asian Americans for Community Involvement.
Right.
That's part of the reason, I served on that board for 8 years. And, part of the reason for its founding was just this issue that you're talking about. It does a wide range of services, but its roots was advocacy.
Yeah.
So we have a lot of resources in this county, different groups that are just fantastic. So always, and if you can't figure them out, ask me. Always remember they're out there to draw on and to ask for,
Right. Aki has done a few presentations for us in the past months, and they're doing another one for another town hall for us next month as well. And I'm sure this is going to come up because it's for general population, that town hall.
Yeah, they've been sending some different things out. And the reason why I served on the board is they asked me to. They asked me to because one of the components of what they do is mental health and suicide prevention.
Right.
So they're always a great resource in that area.
Yeah.
Yeah, and I bring this up because at the Cupertino town hall that I did last night, quite a few of the young people, were nodding in agreement with what some of their experiences are right now.
Yeah, it's a tough time, I think, for a lot. With everything that's going on in Minneapolis right now and all over the country. So thanks for bringing that up. So should we think about, did we want to kind of start over with our committees again?
So it looks like the post-vention work group has accomplished what they needed to. The youth work group is going to continue, and then you want to come up with a couple more. Is that what you're saying?
Yes, I think that's.
Okay.
Yeah, that was the thought, that maybe it's time to have some new work groups to focus on some different areas and keep going with the ones that are not quite done with their mission yet. But I think the post-vention folks have done. We move on to something new now, and we've done some good in that area, and there's probably another area to work on.
Yeah, especially the letter and this resource guide is really good. So yeah.
How quickly is the resource guide? You all are trying to get it through translations, right?
Well, the English version will go to print tomorrow, basically. It'll take a bit to get it translated into the other languages. Yeah.
Okay. Well, I think that's a great next step. That's very easy and concrete to check off the list as well. I know that's aside from the work groups, but just something to get the ball moving on, because that looks great.
Yeah, that should be one of our goals for the next. Yes, definitely.
Good. Always nice to have a goal that we can cross off reasonably easy, right?
I'm really also liking the just to put it out there, the logo. The logo recognition. That's only going to do good things for the task force and the cause. So I think it looks great.
Thank you. I'll pass that along to our designer.
Looking forward to being able to meet in person and do things in person as well. Like you said, using that table thing, which we haven't used yet.
Good. Well, I think we've gotten a lot done today. A lot of good ideas I jotted down, and we can resume the conversation next month.
Yeah, I think that's a good idea. We can decide what committees we want to be on during our next month meeting. Yeah.
Sorry, did we have anything else on the agenda after our general discussion?
No, and I can go back to the agenda. It's just that our next meeting will be on May 11th, Tuesday. I do have something in the chat. Let me see.
May 11th.
Okay. Yes,
May
I'll add you to the meeting. So we'll see you on May 11th then. We don't have anything else on the agenda. This was our most of our discussion for today. So thank you, everyone.
Great.
And
Thank you.
thank you, Lisa, for all your work. We'll miss
Round
you.
of applause to Lisa for her last meeting here.
Oh, thank you. I hope whoever needs to or wants to attends the town hall tomorrow or not tomorrow, next week for the parents. Sorry, I've got so many different things on the calendar before
No,
I
Lisa,
leave.
this is for teenagers. We'll talk.
Teenagers. Okay.
Yeah. The parents is next month, but I'll share the flyer with everyone.
Okay, great. Thank
Yeah.
you.
Thank you. Thank you,
Bye.
everyone.
Thanks, everybody.
Thank you.
Good work. Bye-bye.
Thank you all
Thanks
for
for
giving
all
me.
you're doing.
Bye.